Hi, so today we are going to talk about pancreatic adenocarcinoma. So basically, as the name suggests, it is the carcinoma of the pancreatic gland. The risk factors, the most important one actually is smoking. It shows up all the time in your exams. And the second is hereditary pancreatitis and non-hereditary chronic pancreatitis. Then there's obesity and germline mutations like BRCA1, BRCA2, Peutz-Jeghers syndrome, etc. Then the symptoms. Now, there are systemic symptoms and the symptoms which are due to the presence of the tumor in different locations of the pancreas. So, we'll talk about both of them. Let's talk about the systemic symptoms first. So, weight loss and anorexia, which are pretty much the main symptoms of any kind of carcinoma. So yeah, that will be there. And sometimes in some patients, depression may be the most prominent symptom. So depression, then unexplained superficial migratory thrombophlebitis and palpable non-tender gallbladder. So both of these would be your physical examination findings. And you have a palpable non-tender gallbladder due to the obstruction of the common bile duct, which we will come to in a bit. And so yeah, now let's talk about the symptoms which are dependent upon the location of the tumor in the pancreas. So if the tumor is present in the head of the pancreas and if the tumor is present in the tail of the pancreas. First, let's talk about the symptoms which will come when the tumor is present in the head of the pancreas. So it will typically present with jaundice. Now, why jaundice? It's basically, to be more specific, obstructive jaundice because of the common bile duct obstruction, and your labs will show increased levels of direct bilirubin and alkaline phosphatase. And the patient may also complain of steatorrhea because of that can be due to two reasons. One is your pancreatic exocrine insufficiency or pancreatic duct blockade, which will be due to the tumor present in the head of the pancreas. And then the next thing is, in a patient with these findings, now you need to know that the first choice of investigation in a patient presenting with jaundice would be ultrasound, okay? And the abdominal ultrasound is preferred for detecting pancreatic head tumors and also to exclude other potential causes of biliary obstruction, which might be the reason for jaundice, right? So, for example, choledocholithiasis can be ruled out with a USG, and then you can also locate the tumor. Now, if the USG was non-diagnostic, and here we are talking in case of a tumor when it is present in the head of the pancreas, then the next choice of investigation would be a CT scan, right? If the CT scan comes out to be negative, then the third choice of investigation would be endoscopic ultrasound with biopsy of the pancreatic lesion. Now, I would also like to add that another thing, that usually the patients with a tumor in the head of the pancreas won't present with abdominal pain. Moving on to the tumor present in the tail of the pancreas. So, usually they present with abdominal pain and there won't be any jaundice. So, since there is no jaundice, your first choice of investigation would be a CT scan. Okay, and the CT scan is to evaluate for suspected malignancy in a non-jaundice patient. So that will be your first choice of investigation. Again, it can show you a clear lesion, and if it shows you a clear lesion, then you will have a surgical biopsy and removal, and if it comes out to be negative, then it will be endoscopic ultrasound with biopsy of pancreatic lesion. Another thing is, if the patient is presenting if the patient has a pancreatic cancer and it has already metastasized, so the patient can present with hepatomegaly and ascites. So those can be your physical findings, okay? And the next thing I would also like to add is about amylase and lipase. So many students confuse this thing, that, so I want to clear it out right now, that they are elevated in case of pancreatitis, and they do not have any diagnostic value with respect to pancreatic adenocarcinoma. Also, I would like to mention the tumor marker CA19-9, which is elevated in case of pancreatic adenocarcinoma, but it is neither sensitive nor specific, and you can use the tumor marker to see the progression of the tumor and see if the patient is responding to the treatment or not, but it is not used as a diagnostic tool for pancreatic adenocarcinoma.